What causes cancer? What increases a person's chance of developing cancer? That's a very complex question. But the good news is that science and research has identified certain things that can increase a person's chance of developing cancer. So leading causes of cancer are heavy consumption of alcohol, smoking, and smoking in all its forms, from snuff to the cigar, to the pipe, to the shisha. Anything that contains tobacco is a risk factor for developing cancer. It doesn't matter how it is inhaled or ingested. And this is because tobacco contains several components and chemicals that are known to cause cancer. Another leading risk factor for developing cancer is the type of food you eat. Diets low in vegetable fiber, diets high in fat can increase your risk of developing cancer. Certain viruses and infectious agents can increase your risk of developing cancer. HIV, known as human immunodeficiency virus, hepatitis B virus, and human papilloma virus are viruses that are commonly associated with certain types of cancers. Like HIV, for example, causes Kaposi sarcoma, a skin cancer that is common in the HIV population. Human papilloma virus is 99% present in cervical cancers. Human papilloma virus is a virus that is transmitted during sexual intercourse, and it persists on a woman's cervix for 10 to 20 years and can cause cervical cancer. Hepatitis B virus can be transmitted through sexual intercourse, blood transfusion, exchange of needles, mother to child, and it is known to cause liver cancer.
On your journey to fighting cancer are a team of healthcare professionals whose job is to provide optimal outcomes for you. Although every individual is treated based on presentation, in doing so, they follow a set of guidelines. These guidelines are evidence-based management tips that help inform the decisions on what combination of treatment options will be best and suitable for you on your presentation. In breast cancer, for instance, early presentation is very important to achieving cure. But other factors like the stage at presentation, the grade of the disease, the subtypes of the tumor, the patient's age, comorbidities like hypertension, diabetes, the menopausal status, whether premenopausal or postmenopausal, presence of inherited breast cancer gene like BRCA1 and BRCA2 will determine the prognosis, and the best treatment plan will be based on this. Now let's walk you through the journey of cancer treatment. The first modality of treatment is surgery. Surgery is the removal of cancer cells together with a small margin of healthy tissues around it. This is aimed at removing the visible tumor, the nearby axillary lymph nodes, usually under the armpits. This will be sent to the lab to know the subtype of the breast cancer, the grade, and to determine the prognosis, also the stage. In summary, surgical goal is to remove the visible cancer cells in the breast and also to evaluate the lymph nodes that be harvested. Second modality of cancer treatment is chemotherapy. Chemotherapy agents are drugs used to treat cancer cells. They target rapidly dividing cancer cells to kill them and stop further growth. How is it used? Chemotherapy can be given as a neoadjuvant therapy and can also be adjuvant. Neoadjuvant if it's given before surgery or any other form of treatment, and adjuvant if it's given after. Another major modality of cancer treatment is radiotherapy.
Radiotherapy is a type of cancer treatment that uses high-energy X-rays to kill cancer cells or to slow down their growth. It does this by damaging their DNA. Radiotherapy is important because many people who are living with cancer will require radiation at some point during their cancer treatment journey, either for radical treatment or for palliation of symptoms. There are two main types of radiotherapy. There's what we call external beam radiotherapy, and then there's internal radiotherapy, which is what we call brachytherapy. Under external beam radiotherapy, there's proton treatment, there's photon, which is the common thing that people call external beam radiotherapy, and there's electron therapy. External beam radiotherapy is called external because the radiation, the ionizing radiation, comes from a machine that is outside the body, that is large. Sometimes can be a little bit frightening, but once you get comfortable, you realize that it's just a machine that looks like a CT scanner, really. It directs the ionizing radiation from outside the body into the body to treat the tumor. And it works by damages the DNA of the cell that it hits. And by doing that, it prevents the cell from replicating and from growing. Brachytherapy, on the other hand, is what we call internal radiation. And what happens is that we bring the source of radiation very close to the tumor, usually inside the body, sometimes outside, for example, on the skin. But most of the time it is internal. So for example, with gynecological cancers like cancer of the cervix, the endometrium, with breast cancer, with prostate cancer, we bring the source of the radiation into the body right next to the organ or even inside the organ we're trying to treat, and it delivers its radiation right there. The premise of brachytherapy is that we're really trying to protect other organs that are nearby. So brachytherapy, the source delivers all of its radiation in a very, very short distance. So we're able to get a very high concentrated dose into the organ we're trying to treat without affecting other organs that are in the body. External beam radiotherapy can be used to treat almost every type of cancer. And at some point in the cancer treatment journey, most people or many people will require external beam radiation for something or the other. For example, with breast cancer, after surgery, we give radiation to the chest wall or sometimes to the whole breast, if it was a partial surgery that was done, to prevent a recurrence, because data has shown that radiation will prevent recurrence in these cases. And most time, children, adults, men, women, external beam radiation at some point is often needed in the journey of treatment.